You can have like a QL spasm or a piriformis muscle spasm, and that doesn't necessarily mean you have a pelvic floor problem, but what it does mean is it can influence your pelvis and pelvic floor. So if it goes untreated, you may start to see like, oh, I have like deep vaginal pain on my left side, and it's all caused by this tension in an external area. So it's really fascinating because we don't always think about what causes some of these things, but it could be something as simple like, oh gosh, I do carry my daughter on that side a lot, or I cross my legs that way a lot, or something like that, where just making these small adjustments can really change and influence our bodies.
Wow. Okay, so maybe constipation that we're blaming other things, maybe it could just be the pelvic floor. So how do you know whether it's the pelvic floor?
So oftentimes with I'll speak to constipation specifically. These are muscles, and we need these muscles to have, good bowel movements and to empty your bladder. We need these muscles to relax really well. So if you're experiencing something like you have a hard time starting your urine stream, you feel like you have to push to empty your bladder, starting and stopping of your stream, or even frequent urination, you're going frequently throughout the day or at nighttime, it could be a muscle issue because your muscles aren't relaxing well to empty your bladder. With your bowels, if you have really tight, tense pelvic floor muscles, you feel like you have to strain, your stool is pencil thin, it comes out kind of stringy. You feel like you don't empty completely. You may have hemorrhoids or fissures because you're straining to empty because your muscles are so tense. It's like squeezing toothpaste through a tube and it just can't get it all out. And so those are some of the things that muscles can influence the way that we empty. And it's a little bit of the chicken or the egg. If you have constipation because of your nutrition or from a side effect of medication or a surgery, that can lead to a pelvic floor issue, or a pelvic floor issue can lead to constipation. All that to say, we don't want to just throw medicine or surgery or procedures at people. We really need to look at the root cause or the influencing factors where pelvic floor muscles could be one of them.
So, okay, no toothpaste. So maybe it is just a hydration issue. Who knows? But then if you have, like, I'm assuming if you have more than one of these symptoms, then it's safer to say that this could be an issue because if you are straining, you do have pain during sex, and you are having like that QL thing, like that would maybe mean that there's something there. How do you diagnose a pelvic floor issue then?
So it's really interesting because I go over this in the book, and I think the narrative has often been that we think pelvic floor muscles are just chronically weak. Do your Kegels, tighten your pelvic floor, strengthen your pelvic floor. But many people actually have tension in their pelvic floors. And so for someone who does have QL tension and pain with sex and constipation, I would say they likely have tension in their pelvic floor where you don't want to do Kegels, you want to do more lengthening and relaxation. So in the book, I kind of give you a chapter that focuses on like there's two different buckets, tension symptoms and weakness symptoms. And I ask you which bucket do you fall into? And you kind of look at your cluster of symptoms. And it at least gives you a sense of I need to walk down the path of relaxation, stretching, yoga, learning the proper way to pee and poop, and see if my symptoms get better versus I don't want to do a bunch of Kegels and that's going to make my problem worse. So a lot of it's symptom based. And then I also give you how to do a self assessment. So, kind of either externally or internally through the vagina, how to assess your pelvic floor muscles so that you can tell if they're tight or tender or weak and loose.
Wow. Um, Standing, like a stand squat pee, bad for your pelvic floor?
Not great for your pelvic floor. I do. No.
I had a feeling.
There's a lot of things that are not great about your pelvic floor and peeing, and hovering over the toilet is not the best practice. I think if it happens every blue moon, if you're in a Target or at a festival and you feel like you need to hover, go for it. But if you are out in public, I really recommend that you sit down, clean the toilet, do what you need to do. But when you sit down, you can better relax your muscles, and that's going to help your bladder empty better. The other thing is you don't want to push when you pee. If you strain or push when you pee, which moms and women, we are always trying to be efficient and we are always in a hurry, we will try to push our pee out as quickly as possible. And that can seriously weaken your pelvic floor and lead to leakage or prolapse. So sit, breathe, don't push when you
I
pee.
push and I squat. And I was like, oh, I'm getting my workout at the same time. This is perfect. But I don't like to sit on other people's toilets. I just think that my toilet's the only toilet I want to sit on.
You're not alone, Maria. And I would say that, it's not the best practice. So, in favor of your long-term pelvic floor health, I would encourage you to just line it with some toilet paper and sit down and just take some deep breaths and let your bladder push the urine out for you so that you don't push.
Wow. Is a, like a weaker pelvic floor associated with perimenopause and menopause at all?
It can be a consequence of it. So during perimenopause and menopause, we have decreased estrogen levels. And there are a lot of estrogen receptors in the vulva and vagina. So the vulva is kind of the external area of the pelvic area. So that includes the labia, the clitoris, the opening to the vagina, the opening to the urethra. And the vagina is the inside canal. So all of kind of that moist tissue has estrogen receptors. When our estrogen gets low, whether it's the time of our monthly cycle or heading into perimenopause and postmenopause, those tissues get thinner, they get weaker, we have less tone in our pelvic floor muscles, and we also have less testosterone, which means we have more muscle weakness throughout our bodies, including our pelvic floors. Estrogen also is responsible for creating a protein called collagen. And we're very familiar with collagen because we talk about it when it comes to skincare for our face and the rest of our body. But you also have collagen in your pelvic floor tissues. And that collagen also gets weaker and less supportive with aging and perimenopause. So, yes, your pelvic floor can get weaker. You're more susceptible to urinary tract infections, frequent urination, painful intercourse, urinary leakage with aging and these hormonal fluctuations. So, I really look at perimenopause, which is what I'm in now as a 42-year-old woman. And I think everybody's like, oh, it sucks so much. And there are definitely things that suck about it. But I also think it's a little bit of a yellow light for us. Like, hey, this is coming. This change is inevitable. We're going to have no estrogen and testosterone stores in our body eventually. And what can we do to use this runway to strengthen our muscles, including our pelvic floor, to optimize our pelvic floor health so we're not faced with leakage and prolapse and pain down the line?
Yeah, my mom had to deal with a lot of that stuff, and I didn't really quite know anything about it. Um, so when you talk about a lack of estrogen down there, there was something else you said that there's a lack of. What was it?
Um, Testosterone and collagen.
Collagen. So sun creates collagen. There is that whole TikTok craze of people doing like the splits into the sky so their vaginas get sun. And everything that I've been studying about the sun and how magical it is for our health, if you think about it, the two things that never see the sun for women is our breasts and our vaginas because they're always covered. And so I wonder what your position is on getting sun down there to help with the hormones and then also to help with the collagen.
It's interesting. I've never actually thought about it. I don't know the research on it. Do I think it could be harmful? No. I don't think there's any negative side effects. Do I think it will be enough to really change the tissue integrity and support of the muscles? Minimal to if none. I mean, instead of spending 20 to 30 minutes sunning your vulva, because the pelvic floor muscles are internal as well. Like they're still not going to see the light, right? So maybe the external vulvar tissues might, but the internal vagina and pelvic floor will not. I would rather you spend 10 or 20 minutes doing strength training exercises and breathing techniques and doing things that are going to kind of give you long-term optimization versus sunning your vulva. So, do I think it's a negative? No, but I think it shouldn't be the only solution to long-term pelvic floor and vulvar health.
Got it. Do you, okay, when you think about physical therapy in this arena, it sounds like my worst nightmare. Uh, I became my annual appointment. I used to have to like really prepare myself mentally, but now I've gotten better. A couple surgeries and catheters later, I'm like, meh, I guess I don't care anymore. But what does that entail? I mean, from what was going on in Hollywood for a minute was this like whole craze of like people are going to get their vaginas, their pelvic floors handled, and people's, random they're going in there with their
Yeah,
hands and they're
we
doing
go in
stuff.
there.
So
Yeah.
tell me and everybody what that is like.
I think it's really funny because we don't think about muscles in this part of our body. But as a physical therapist, We do. We work with muscles and tissues and nerves in your body. And I happen to work with the muscles and tissues and nerves in the pelvic region of the body. I also think it's really funny because we'll get patients or clients who call and they're like, what should I wear? I'm like, whatever you want because you're going to be naked from the waist down. So it's like, but typically what we do is an initial session will be in a private treatment room with a physical therapist. And you do have to have special training to be a pelvic floor therapist. It's not, we go through specialized courses. I have a board certification. So there is a training you go through. And you sit and talk about your symptoms. Even if you're coming in for painful sex, I'll ask you about your childbirth, your menstruation, your peeing, your pooping, all of these things. We do look externally first. So with your clothes on, I'll look at your hips, your abdominal wall, see if you have any scars or, tension or restriction outside the body. And then the way that we assess the muscles internally is the patient undresses from the waist down. You lie in a kind of a mat or a bed covered in a sheet. It's not like you're in stirrups. And then we do an intravaginal assessment to get to the pelvic floor muscle. So with a gloved hand, I take my index finger, insert it into the vaginal canal, and I ask the patient to squeeze around my finger. And that's how I assess the strength of the muscles. Then they relax. I can see if the muscle's relaxing well. I ask them to push or bear down to see if there's any prolapse or weakness. And then I press on the side walls on the left and right to see if there's any tension or tone in the muscles. So it's just like if I was seeing somebody for neck pain and I kind of worked on their shoulders, but the way that we get to the pelvic floor is through the vagina. In some women and in all males, we go through the anal opening. But this is always with consent. It's somebody, if somebody doesn't want it, we don't have to do it, but it is how we assess the pelvic floor.
Wait, so in some people you have to go through the anus, you said?
Yes. So, well, in all male bodies,
Oh,
and some
male.
some people don't want a vaginal assessment. Some people might have an infection, and we can't do a vaginal assessment. So, some people might have tailbone pain or pooping issues or rectal pain, and we'll go through the anal opening instead.
And you can figure it out from there because it's all the same.
It's just a different avenue, right? I mean, it's just the posterior back part of the muscle. So yes, I mean, and when I'm in there, I mean, it's anatomy, so you kind of know what muscles you're on, and it's just like we know the external muscles here. It's the same thing.
Hey, Heal Squad. We have been on quite the journey together, and we're hearing from so many of you just how much this show is helping you heal and get better, and it makes us feel so good. We love, love, love it, and we just ask that you don't keep it to yourself. Spread the message and share the show or your favorite episode with your friends. And if you want to help us even more, you can leave us a 5-star rating and a comment on Apple Podcasts or Spotify, and follow us on Instagram at Heal Squad. You can also DM us anytime because we love connecting with you. And finally, you can also join us on Patreon for our monthly live heal events with world-class healers and ad-free episodes exclusive only to Patreon and our Super Heal Squad for as little as $10 a month. So go to patreon.com/Heal Squad to join. Getting better isn't easy, friends, but as I say all the time, it's a whole lot easier if we can do it together. We love you all so much, and we love doing this thing called life with you.
This podcast and all related content published or distributed by or on behalf of Maria Menounos or MariaMenounos.com is for informational purposes only and may include information that is general in nature and that is not specific to you. Any information or opinions expressed or contained herein are not intended to serve as or replace medical advice, nor to diagnose, prescribe, or treat any disease, condition, illness, or injury, and you should consult the healthcare professional of your choice regarding all matters concerning your health, including before beginning any exercise, weight loss, or healthcare program. If you have or suspect you may have a healthcare emergency, please contact a qualified healthcare professional for treatment. Any information or opinions provided by a guest expert or host featured within website or on company's podcast are their own, not those of Maria Menounos or the company. Accordingly, Maria Menounos and the company cannot be responsible for any results or consequences or actions you may take based on information or opinions.